Good morning, Mrs. Chu. My name is Charmaine. I'll be the nurse looking after you this morning. The time is now 5:30 and I've spoken to Dr. Jones and she's happy for us to start you on some IV antibiotics. She saw you earlier and she's spoken to you about that, I believe. So what it really just entails from my end is that I will set up a small bag of fluids just here on the IV pump, connect that to some tubing, and connect that tubing to your IV cannula, which is currently sitting in your right hand.
Explain any potential side effects from the medication. When confirming patient identity, ask the patient to state their full name, date of birth, and confirm this with the medication chart and the patient's identification band. Check the patient's MRN, or medical record number. After leaving the patient bed space, check the medication prescription for legality. Collect your equipment. Here you can see in this kidney dish, I've got a pair of non-sterile gloves, at least 2 alcohol wipes. Here is a 10 ml syringe. This is my diluent, which is the water for injections, 10 milliliters. You can also see the expiry date there. Here is my vial access cannula. I'm also going to need a 21 gauge needle. This is a sharp. It's also optional to get a drawing up needle, which I'll show you how to use momentarily. Here is my medication, and I can see that it's Kefazoline 1 gram for IV use. And I'm checking the expiry date here. So I've checked the expiry date of both my diluent and my medication. That's the top lid. Here is my blank IV additive label. And later in the video, I will show you a completed label. I've also got my bag of IV fluids. It's a 100 milliliter bag of sodium chloride, 0.9%, also known as normal saline. You can also see here on the bag it says injection solution for intravenous infusion, 100 milliliters. And all the way at the bottom has the expiry date. So you're also checking the bag for color, clarity, and integrity. Here's my giving set. It's a macro set as indicated by the 20 drops per milliliter symbol, and the hourglass has the indication of the expiry date. Plastic bag, a bluey, and some micropore tape if you don't already have it. I'm now going to do the first check. Right patient. Right medication. So I'm going to give Kefazoline. Route is IV, dose is 1 gram, frequency is 6 hourly and at 6 o'clock. Today it has not yet been given. I've always got to compare product to prescription. So I can see here I've got Kefazoline, 1 gram. At the bottom of the label it says for intravenous use. Here is the Australian Injectable Drugs Handbook. If I turn to Kefazoline, it'll say for IV use, preparation for IV use. Reconstitute the vial with at least 10 milliliters of water for injections. That's my diluent. I'm checking my diluent, water for injection, 10 milliliters. We go back to the Australian Injectable Drugs Handbook, Kefazoline, down to IV infusion. Dilute the dose with 50 to 100 milliliters of a compatible fluid and infuse over 10 to 60 minutes. That means you can choose any volume between 50 to 100 and any time between 10 to 60 minutes of duration. Compatible fluids. includes sodium chloride 0.9% or normal saline, which is what we have. So 100 milliliters of normal saline. You can check the route in the bag. It says for intravenous infusion. So I'm now going to show you the procedure for preparing the injection for eventual injection into the bag of fluid. I'm going to show you a couple of different angles just because I feel as though that might help a little bit more. So right now I've attached a blunt drawing up needle, which again is optional, depends on your hospital policy. But I'm using this to draw up my 10 milliliters of water for injection. This is my diluent. I'm recapping that needle because, as I said, it's blunt. There is no sharp end, but it will go into the sharps container at the end of the procedure. I've attached my vial access cannula, which again is not a sharp. I've opened the glass vial ampule lid. I've just swabbed it with an alcohol swab as well. And I've inserted my diluent syringe. I'm just placing in a few milliliters of my diluent into the glass vial, mixing it, making sure everything is diluted, and I'm drawing back. I need to make sure that everything is drawn up and there's nothing left in the vial to make sure that I have the accurate dosage. I can place the cap onto my vial access cannula, and I can now attach my actual sharp, the 21 gauge needle. I'm adding the solution to the bag, so this requires me to locate the medication injection port. On this bag, it is white and indicated by an upward arrow. This particular brand or manufacturer of this IV medication bag keeps a cap on the end which you have to flick off. The medication injection port inside is self-sealing to prevent introduction of microorganisms after repeated use. Remove the needle cap from the syringe and insert the needle of the syringe through the center of the injection port at the site. Inject the medication. Withdraw the syringe from the bag. Mix the IV solution by holding the bag and turning it gently end to end, and this allows the even distribution of the medication. Complete the medication label. So now I'm going to show you the preparation of the medication before it's injected into the bag, but from a bird's eye view. I can now do my second check of both the fluid and the medication. When performing the second check, ensure that there is a comparison of the prescription to the product label on the vial. The second nurse will also need to sign the IV additive label. There also needs to be a second check of the IV fluid. So now that we've added the medication to the bag, we can now open the infusion set, maintaining sterility of both ends of the tubing. Place the roller clamp about 2 to 5 centimeters below the drip chamber and move the roller clamp to the off position. Close proximity of the roller clamp to the drip chamber allows more accurate regulation of flow rate. Moving the clamp to the off position prevents accidental spillage of fluid and decreases the amount of air bubbles when priming the line. You can now remove the cap off the spike and connect it to the IV tubing port on the IV fluid bag. Do so without contamination. Here I'm squeezing the drip chamber to fill to 1/3 to 1/2. I'm proceeding to slowly release the roller clamp in order to prime the line. Be certain that the tubing is clear of air and air bubbles. To remove small air bubbles, firmly tap the IV tubing where the air bubbles are located. Check the entire length of tubing to ensure that all air bubbles are removed. Upon entering the patient's bed space, ensure that you complete the 5 moments of hand hygiene, and you can now do your third check of the 5 rights. This third check must be done at the patient bedside and must include a patient identity check. So ask the patient to state their full name and date of birth, compare this to their armband and their medication chart, and check their MRN. Also, ask about allergies. The third check must also involve the comparison of the product label on the vial to the prescription and the third check of the IV fluids. Do all 5 rights for both the IV fluid and the medication. I'm now donning non-sterile gloves in order to assess the IV cannula site and its patency. I'm going to show you a couple of different angles when it comes to assessing the IV site and swabbing it with an alcohol wipe and connecting the IV tubing. So I'm placing underneath the patient's cannula site or limb a bluey, so that in case there's any fluid leaks, it won't soil the bed linen. I'm just gently palpating around the site, and you would ask the patient if it's tender, and you would be feeling for any localized warmth, coolness, and inspecting the site to see if there's any swelling or redness. Here's the patient end. I'm just taking the cap off now. And I go straight in to connecting that to the cannula. While stabilizing the cannula with your non-dominant hand, connect the IV tubing to the patient's cannula. Do so without contamination. I'm taping to secure the IV tubing on the patient's arm. I'm placing a bit of tape over the rigid part of the cannula and over the other side of the IV tubing looped. And this way it's not causing tension or pulling onto the IV tubing and the patient's cannula. When supporting the cannula with your non-dominant hand for swabbing and connecting, ensure you are just holding it gently, not pulling it or moving it, so that you're not causing trauma or pain to the patient. You can now set your rate by watching the drops as they fall inside the drip chamber, comparing to the second hand on your watch and controlling the rate using the roller clamp. Ensure your drops per minute rate is accurate. Conclude your interaction with the patient, leaving them calm, informed, and reassured. Perform hand hygiene, dispose of all your rubbish, dispose of your sharps into the sharps bin, and perform accurate documentation in both the medication chart and the fluid balance chart.